Okay, it is 4:35 p.m. and we'll begin the program committee meeting on September 16, 2020. Everybody received an email with the agenda, correct? Well, we can, if you don't have one in front of you, we can reread every item on the agenda. Robin, would you please read the first item and discuss about it?
Sure. The first item is the Ohio MAS fiscal year 2021 crisis infrastructure funds. And this is in regards to the implementation of telemobile services. As you know, with the strategic plan and the community plan, we've prioritized evaluating our crisis services and making recommendations back to the board for improving the services. So Mircha and I have been participating in what's called crisis academies hosted by OMAS, as well as weekly discussions with Firelands and the Erie, Ottawa, Huron County boards to evaluate our system and to look at what our needs and gaps are. We've also recently been awarded Ohio MAS Crisis Infrastructure Funds in the amount of $92,152 to address our needs. And we've concluded at this point that we need and want to move towards increasing our telemobile services with regards to crisis. As COVID hit, our system began to move towards telehealth services. With crisis services out of a need to basically protect staff. And a lot of what happened around us is the rules began to change because of COVID. So prior to this, there were some hoops and challenges with telehealth service delivery that seemed to go away once COVID hit. And so we're at the point where we would like to propose two projects. The first project would be to support Firelands Counseling and Recovery Services in enhancing their current crisis system to expand on telehealth services. They're proposing that they would like to add 3 full-time employment positions to include 1 case manager in our board district and then licensed therapists to cover their daytime and after hours emergency services using telehealth services whenever possible. They'd really like to be able to go into the client homes. And this meets the definition of mobile services. But they feel that, there's some safety issues there that they have to keep in mind as a system. And so what they'd like to do is just slowly move towards it. And right now what they want to do is continue to go into the jails and the emergency rooms, but also include group homes and recovery homes, and also go into homes of people that Firelands knows and are familiar with, so they have a better knowledge of the client's history and potential violence. They also want to hire a full-time case manager, or it's called a CPST, in SSW to respond to the crisis calls when hotline has deemed it safe and appropriate to use the case managers. And the idea is, different things happen in the Firelands crisis system. Sometimes they're backed up on calls, and so a therapist cannot get to the next call. And so they would like to be able to use a case manager along with a peer service to go out to the home and be with the client when they're backed up, but also during the process of the client being evaluated at home through telehealth services. And I'll talk a little bit more about the peer portion of that, because that's going to fall on the second portion. But with Firelands, they want that peer to work with that case manager going into the homes. Also, Firelands would like to increase their hotline staff by a 0.5 FTE to assist with managing the calls during their high volume times, as well as they'd like to be able to purchase the equipment it would need to sustain these services and to provide the training that's needed and the supervision for the expansion. Their projected budget for this expansion would be roughly $89,714 right now. The second component we would like to propose is adding the peer support services to the crisis system. So this is that person with lived experience that would go out with the case manager to the client's home to provide support. This has been a missing piece in our crisis system for some time, mostly due to the barriers that we now feel we can overcome. And we've talked with NAMI recently, who's always wanted to add peer services to their programming, but they just couldn't do it because they couldn't allocate the resources to get to the point where they could offer it and sustain it in their budget. The peer services would be an added component to the mobile crisis services offered by Firelands, as mentioned, and they would work through the implementation pieces that allow them to figure out how to provide the peer support services when billing Medicaid. So, if we said today, NAMI, you can do peer services, they're not ready. They've got to figure out the pieces and work through those pieces so they can bill Medicaid and so they can make sure they have the certification for the peers in place and have the right supervision for that. So there's a lot of pieces that they feel they have to put in place before they can actually begin to provide that service. And so they would like to hire someone to be the coordinator to work through that implementation phase. And they estimate that this would cost them right around $56,000 for a 9-month period. Now, the end goal here would be for them to develop peer support services for multiple projects. That includes expanding their CIT program and developing their sustainability plan to include the Medicaid billing piece. And so the infrastructure funds that I mentioned earlier for $92,000 really would only cover the piece that Firelands is doing. And if we were to add the second component of the peer support services through NAMI, we would have to look at using levy reserve funds to add that portion. We still have some discussion and details to work out with them. So I'm not sure that we can have this ready by September board meeting next week, but certainly we hope to. So NAMI can get started on their pieces. If we don't have the final details worked out, we would have to add this on to the October agenda for the board.
I have a question with they're thinking like that peer support would only be one person. I mean, that's all that those funds would cover, right?
Initially, it would cover the person who would put it out, figure out the implementation pieces and get it up and running. And that actually most likely who they're thinking of would be somebody who down the road would play a role as supervisor. And so they want to have that first 9 months to figure out how they even get up and running to have the peer support services and then hire in the peer support person to actually deliver the service.
And then the hope would be they would get the funds because they'd be able to bill Medicaid once they got up and running. So they went to...
And that's something we brought up with them, to bring somebody in to do the implementation piece is fine, but then you got to have the sustainability after that. Right. And so they would need to expand this. They want to start this in just part of SSW, but they vision and see this expanding into Erie, Ottawa, and Huron counties, and they would need to for their sustainability because yes, they could become a Medicaid provider, but they need to have more than one peer support person in place to draw in that money that helps to pay for the expenses of someone like a supervisor.
Because Medicaid wouldn't pay for it solely. I mean, they wouldn't support all the funds they would need. I mean, they'd have to supplement them some other way, right?
Yeah, and we project that there could be some expenses even after the first year to help them as they build up to this. But ideally, it would be just like with Firelands. The idea is they build up their own sustainability to where they don't need to lean on our funds as much.
That's exciting.
Mirch, I know we've had a lot of discussions and we're still trying to put all the pieces together and really picture it. I don't know if there's anything you wanted to add to that.
Well, what I would like to add is that having a mobile response team for clients struggling with mental illness, including being in a crisis, I think it's a hefty step for us as a board and something we just dream of 5-10 years ago. I know also Robin, she mentioned Huron, Erie, and Ottawa. I think they are kind of in a pause, waiting to see if we can get it up and running. And at that time, if we can, through NAMI, if we can find out the Medicaid piece, I think that at that time it's a high probability this will be expanded in the other 3 counties outside of our board district. But obviously the expectation of then is for those counties to pay a larger share of the expense of this program. So as of today, I think we have both Firelands and NAMI committed for us to really take on this challenging project, which, as Robin mentioned, it's expensive to start it. It's expensive to start and to implement it, but we hope that in time this will be sustainable. We do have a commitment from the state regarding implementation of these programs. As Robin mentioned, the state committed to us $92,000. It's just that together the 2 projects going to probably cost us $150,000 or so. So we are looking at $50,000-$60,000 that will have to come out of levy reserve funds, at least from now until June 30th of next year. And after that, we'll have to see where we are with various budget items with the state and maybe even through the federal government. And then also see their Medicaid piece before we can see what next year might look like.
And what we do know with NAMI is, we've had to invest in other programs with them, and they've done a good job. I mean, CIT is probably the best example. We started out small with them, and they've really grown that to be something to where they are recognized in the state for exceeding and excelling in their program delivery. Same with the navigation program. We feel like we've given that to them, and they've really gotten that going well. So, like Mirta said, yes, it is going to cost us a little bit more in the beginning, but our history with them is that they take their programming very seriously and really work to grow it. And this does fall in line for them, right along with what their mission is and where they want to go with CIT, but also with the crisis system.
There's quite a bit of expansion in the state of Ohio when it comes to peers, but I would say the majority of them are AOD focus or addiction focus. So for whatever reason, now and historically, Firelands or even other providers in Ohio had a harder time finding or committing mental health peers to services than peers coming from the addiction side, which I think you can imagine why. But Robin, it's right. I think this peer can play a big portion of the CIT that the NAMI does. And I do want to mention to everybody that last week they started the first pilot hybrid online program, our NAMI chapter in the whole state of Ohio. So it's very, very much recognized. I do think we have probably one of the top programs, if not the top CIT program in Northwest Ohio, in the entire state of Ohio. And Kelly, I do want to mention that Fostoria PD had probably 5 different officers, including the chief, taking part of the CIT. So at least the ball is moving in the right direction. So step by step, I think again with the investments we made as a board in the past, plus with their work and the people they brought around various programs, as well as, again, Robbie mentioned. I think we did such a great job with CIT that Erie and Ottawa now are just asking for expansion, and they have expanded in those two counties, taking our CIT model. So it was great. Last Thursday I participated, and the Ottawa County Sheriff was there, and Erie County, officers were there. So it is. We see the same thing here. Hopefully, as long as we can sustain it long term, it will be kind of up to them. It's something that, as I mentioned 5 years ago, it was just a pie in the sky, and I think we might be able to get it implemented. Any questions or comments?
I just think that's great that they finally got on board.
I do think that the hardest piece to come is when it comes to services at people's homes, is obviously taking into account safety, as well as taking into account law enforcement involvement. So those will be two big pieces that I think we'll just have to learn as we go and see how they will be taken into account. And obviously with COVID, it appears that based on the county colors, this might also have an impact on responding to people's homes. Pali, I think you mentioned something, but you are muted.
Oh.
Now we can.
Now you can hear me.
Yes.
Okay. I just want to say I've seen these mobile crisis units work, and in large metropolitan areas. And in reality, it certainly helps just not only for the initial aspect of not having to go through an emergency room for care, but I think it helps to establish a more long-term, a more long-term type of intervention that the facility can give to the patient. I think this is an excellent program, and I just hope we can see it through.
Thank you, Polly. It also looks like Marcus has joined us.
So I guess last thing that.
Yes, I've been on. I'm just listening right now.
Last thing I would like to mention is Robin said we have some follow-ups early next week with both organizations. We do have a next estimated budget. If things don't change dramatically from now until next Thursday, we'll probably have this as a motion for the board meeting. We do have the funds in levy reserves that are available, and we are still within our policy when it comes to utilizing levy reserve funds. So there shouldn't be a problem. So unless something major changes or we still got to work out some details, we will probably have this as a motion during the board meeting. Any other maybe comments or questions before we move to the next item on the agenda? All right. The next item on agenda, it pertains to Sandusky County task. It's regarding two different funding source line items. One is the SAPT Blood Grant Fund, which is Fund A132 with our board. These are federal treatment allocations for substance use treatment. We have received our full allocation. We have earmarked $47,558,000 for task. We're just waiting to make sure that the full allocation will be committed to the board, and it appears that it is. We already received the first quarter allocation of those. Those funds currently, large portion of them goes to violence for SUD treatment. Another 50,000, I believe, goes to Oriana House for treatment, and 47,558 will be with task for case management, drug testing, and assessment. For the new ones, if you don't know, this is a little bit of education. There are 7 test programs in the entire state of Ohio, maybe 6 now. We are lucky enough to have one in Sandusky County. Really, the main 3 services they provide is assessment, case management, and drug testing. But they are a certified program to the state of Ohio. They actually operate under the Sandusky County Commissioners. Again, they don't provide treatment or therapy per se, but they work closely with other treatment providers or community stakeholders. So there will be an amendment to their contract unless you guys have any questions or oppose that. Again, we already earmarked these funds at the beginning of the year. We are just waiting to make sure that the entire allocation is committed to our board. The second portion that I want to mention, but will probably not act on it, Sandusky County Clyde Court received and continues to receive what's called ATP funds through the state of Ohio. They stand for Addiction Treatment Program funds. In fiscal year 2020, the year that just ended June 30th, all those funds were not spent by agencies in Sandusky County as planned by the Clyde Court. In fiscal year 2021, Sandusky County Clyde Court received additional ATP funds. So I was in contact with the Judge Colosard in Clyde, asking him how he is planning to utilize these funds. We are being used by the state of Ohio more as the fiscal agent. We are not keeping any funds for us, any administrative funds. We really supposed to work with the judge, see what his needs are, and then contract with various behavioral health or housing providers in our district. In the past, again, they contract with Sandusky County Task Violence and a housing provider, which was CAM in Sandusky County. This year, the judge wanted to use the funds just for task and violence initially, but I believe I did mention this to you guys already. Violence has refused to enter into a contract for services for Clyde Court regarding this program. So right now, the judge is trying to find out what kind of agencies or provider he has available to assist him carry on this program. So we don't have any amounts that the judge has agreed on yet. Again, the money are there. I believe between fiscal year 2021 and fiscal year 2020 are close to $100,000 sitting on a table that the judge will have to decide which agencies he would like to use. Again, a big portion was violence in the past, but violence has refused this collaboration regarding ATP with Sandusky County Clyde Court. Any questions?
Are those funds like a use it or lose it?
Those funds they had in 19 and they haven't used it all, but we were allowed to carry them over into 20. Then in 20 we got more money, but in 20 we used the 19 carryover, and then now they allow us to carry the 2020 into the 2021, but now we got more 2021 funds. To be honest, it's very hard to spend the funds because of the restrictions of the funds. The funds are very specific to core clients. Agencies have to bill Medicaid. Well, 90% of them are already Medicaid. So in Seneca County, the courts contract with Oriana House, which is also a large agency, and same thing happens. They just cannot spend the money from year to year. So I had some discussion with Robin last week and even early this week. We're trying to engage the state to see if we can somehow become creative on maybe some housing needs. The same thing is happening with a different funding source that the admin committee discussed Monday night, and those are CTP funds. Same thing, we have a lot of CTP funds available that we just cannot spend. Those are specific to people coming out of prisons into our board districts. Well, we have approximately maybe 20 a year. They come into our 3 counties, and out of those 20, only 10 ever choose to engage in any sort of services. So it's hard to sometimes spend the funds. So I don't believe we'll have a motion for ATP unless the judge, the reason I put it on the agenda, unless the judge from now until again next Thursday is giving me some clear dollar amounts, then we might put it on the agenda for a motion to be approved. But so far, to answer your question, we didn't lose it. We didn't use it, but we didn't lose it yet. These funds are specific to specialized courts, so and it gotta be something related to addictions. So in the 3 counties, the only 2 courts they have something like this are Clay Court and Seneca County Pivot. Again, it's very, very little discretion we as a board have when it comes to this. We are again acting more just a pass-through as the fiscal agent. Questions? All right. Robin, would you talk about the 3rd item on the agenda?
Sure. This is in regards to the fiscal year 2021 SPIF RX grant. SPIF stands for Strategic Prevention Framework. And this is a federal grant that we actually received in federal fiscal year 20 through OMAS, and we're looking to receive it again in fiscal year 21. For this particular grant, the fiscal year runs September 1st through August 31st, and it'll be in the amount of $13,000, which is what it was last year. This grant can be used to address prevention for prescription drug abuse in Seneca County. Last year, we used it to promote our prevention messages, such as Take It to the Box campaign, and then other information disseminated through pharmacy bags and media, local media. We're looking to do the same in federal fiscal year 21. And again, it's specific to Seneca County, and we're limited on who we can contract with these federal funds. And we have limited options for agencies that can meet the requirements to be able to receive these funds and do prevention. And so we're not looking to have to enter into any type of contract for this. Probably what we'll do is work with the CARSA Coalition, and they'll do the work to get the messages together and the expenses maybe on a billboard, and then have it invoiced to us, and then we will pay it out of these funds. And so this is more of an FYI for the board that we're looking to receive the funds again in fiscal year 21, and that there's no board action needed at this time.
Any questions or comments about these funds?
No questions.
The next item on the agenda is the K-12 prevention funds. As you recall, late last fiscal year, the state of Ohio awarded the board $256,366 to work with the local schools and implement a plan, conduct an assessment to every school, and implement prevention programs, evidence-based prevention programs in each of the schools. At that time, though, however, again, the schools had to sign an MOU and agree to some of the terms, agree to do a school-wide assessment, agree to implement and work with us as a board and the community prevention coalitions to implement evidence-based prevention practices. The schools just couldn't take the money and do really whatever they wanted with the money. These were a little bit more strict about, hey, it had to be behavior health prevention specific, and you have to show us a plan and can be implemented anywhere from K to 12. We want to see a school-wide prevention system for the students, I guess. Well, out of all the schools within the board district, there are 5 schools that have not participated and the deadline passed. So then we took the money and applied our formula, and all the schools that participated got a little bit more. So we are in a phase now that all the schools are almost completing their assessment and implementation plan while working with our prevention specialists in the field in the 3 counties, and we will probably need a motion in able to pass these funds through the schools. I can read you guys all the amounts, and I can read you the amounts for every school. In the motion you will have that. Fremont City School will receive $55,273.02, and this is the highest amount out of all the schools in our board district. North Central Academy in Seneca County will receive $6,315.39, and that is the smallest amount paid to a school in our board district. If you wish, or if you want, I can read all the schools, but again, was a formula based on student population as well as a base amount. So Fremont, as being our largest school, it's getting a little bit over 55,000. Second will be Tiffin City Schools, and so on. The school that didn't participate, I'm gonna just mention, it's Clyde, Green Springs, Gibsonburg, Woodmore, Alford, and Bridges Community Academy. Those are the schools that didn't participate. Yes, there was a little bit of work required on the school end, and it's not something that we as a board created. These were the requirements implemented by Ohio Department of Mental Health, and we just assisted them with those practices. And again, some of the schools chose not to participate by not completing the assessment and signing the MOU. Any questions? One thing that we really wish to come out of this, it's something that, again, just educational for the newer board members. Us as a board, for many years, we always supported the schools in implementing either prevention or treatment behavioral health within the school. But in the past, everything was funded through local levy funds, and in the past, not all the schools participated for whatever reason. We had schools that we had a long history with, such as Upper, for example, Tiffin, Seneca East, Fremont. Some of these schools, we have a long history of collaboration and implementation of many programs, and they always took advantage of what we had available. But then we had some other schools that we just didn't really have that, and we weren't sure if they are afraid as our levy process was competitive in the past or not. But we really open it up to everybody to apply for local levy funds and collaborate with them and assist them. And there are still a few schools that choose not to participate. So I just wanted to mention that, and again, we are very flexible on how these funds can be utilized, especially when it comes to levy. But we do have a few outliers. I do know that Gibsonburg just hired a new superintendent. I know some of them have some changes, so I'm sure this will probably change year to year.
Mayor Cha, does the population for the school, does that count the kids that are on the online school now, or just the kids that are face to face? Do you know?
Yes, what I know is that the formula was applied pre-COVID-19. So
Okay.
they will tell me there was, again, I think we applied the formula in December of 2019 is when we took the numbers. These funds
Okay.
were received by us in the fall of 2019. So that is the numbers that we utilize for the formula. So it's, I guess, in the benefit of the schools.
Definitely.
I do want to mention that we did a very similar formula for levy funds, and when you had students that or schools that have students from various counties, we apply amounts from various counties. Some schools actually receive more than really what their request was, such as Fostoria, for example. But they're planning to utilize that to expand some of their services. I know this is very tricky. Kelly, you brought a very good point, and I know our prevention specialists are looking. Is like, how are you going to implement all these things for students who now are taking online classes, or students who are now being, increasing homeschooling, and how we're going to apply all those things? Well, I think it's something so new that everybody's trying to figure it out how that exactly will work. I know our
Yeah.
in-school counseling and prevention programs, as soon as the school closed, everybody was kind of a little in a panic mode. Is like, what are we supposed to do? We don't want to lose the contract. We don't want to have to lay off people, but at the same time, everybody's home. What kind of services can we provide to them? And honestly, just my opinion, I think the schools will really have to be creative to continue to engage these students and families, even if they're taking online classes. Because I'll not be surprised if you see a change in formula when it comes to funding coming from the state to the local schools if they lose a lot of students to various online programs.
Yeah, because I know that there's at least 439 of us just at Tiffin City that are doing the Tornado Academy.
And Kelly, didn't they say that's about 25%?
They did, yes.
Wow. And I know there are schools, other schools in our board district that didn't really have kind of their own academy developed, but they contract out with somebody who had. So, the money from the state still flows through them. But if they take $1 per student from the state, now they got to turn around and give 50 cents to this online program. So I think the school's going to have to be creative how they can retain and keep those money in the future. Now, I know homeschooling, though, because I'm directly impacted by that. I do know the homeschooling, the school loves it because they take 100% and stays with them of that student.
Mircha, I just have to say I give your wife a lot of credit because I'm ready to pull my hair out.
Yeah, I think she has a harder time because this year it's 2. As you know, we started this pre-COVID-19. Wasn't because of COVID, but now she's doing 2. She wants me to do some of the work when I get home at night, but I'm telling her no, it's not in my contract. Okay, I'm gonna move on to next board strategic plan. We sent you guys the draft. We had an ad hoc committee that worked on this for over a year. I also received some feedback from some individual board members. We make some adjustments. One thing I do want to mention is, again, we delay approval of it because of COVID. We wanted to meet face to face. Well, I don't think we should just stay because we just don't know when we're gonna get face to face. So, the other thing I want to mention is that honestly, we kind of start working on this on our main 3 goals. If you look at the goals, you might say that they are very, maybe I call them open or maybe not too specific, but honestly the committee did that on purpose. With our first strategic plan that we implemented 4 years ago, we were extremely specific to our goals, and again was good because it was our first strategic plan. But what we realized is that we implemented the goals in like half the time, and again the goals were very specific. For example, pass this levy. Well, as soon as you pass the levy, the goal is marked off the list. So again, we were very specific. But now we actually took some goals that I believe, especially goal number 1, it's again a very complex situation that we are taking on, and again we left it open just because, one, due to COVID and how our budget can be impacted, what kind of capacity our providers might have. So some of the indirect things that can affect our board. So we left it a little bit more open, the implementation of this. And initially, I think we had 5 or 6 goals, and they chose to reduce it to 3 to really focus, especially on the first 2, They had to do one with the crisis system, and the second one was with children involved in multiple systems. As you guys know, we have a lot of children now in our system that are with children's services, they maybe are with Board of DD, that are with the juvenile court. I think every day, this week and last week, we had a call about somebody involved with another system as well as us. So we continue that collaboration, and we are having some new things happening. But we do have the strategy plan. I believe I emailed it to you at least twice. The last version I emailed it, I believe, yesterday. I am strongly recommending it, that we are approving this, so that the ad hoc committee can continue to meet every 3 to 6 months to look at the progress. Any questions? Again, you can always change the direction a little bit of this strategic plan, so we can again always change the direction. We could amend some things, and based on what's happening around us, we might be able to change some things. All right, the next things are no motion, are just updates, and I would like to have some open discussion if you guys want at the end of the meeting. Admin committee, we had a great discussion at the end of last meeting, just open discussion. All right, so we have 3 new federal grants that we are very confident we're gonna renew coming up. They all should begin anywhere between September 28th and October 1st. We don't have all the specifics yet. Therefore, I don't think we can bring this to the board for motions. But the first one is a renewal of a federal SPF prevention grant. This is in collaboration with all 3 counties. The second one is a SOR grant, which stands for Treatment and Recovery Support Services. Robin is having a 3-hour conference call on Monday about how they will continue in our board district. And the third one, it's a HRSA, again, federal prevention grant, coming directly from PIRE to us, is not to the State Department. Their grant is where Nicole is taking the lead, and actually their grant is paying for, between SPF and HRSA, is probably paying 85-90% of Nicole's salary and benefits. So she's taking the leads on those 2 grants. One thing again I want to mention is probably not going to bring any motions forward because we don't have all the specifics about next year of some of these grants. One thing again I do want to mention is that we have, I think, expanded a lot of bringing outside federal grants directly to the boards, which is a great thing. But we are working on a system change, if I say, that we want to bring forward to you guys probably in December. We brought, which is again in a positive way, a lot of grants, but I don't think our system can handle all of them necessarily. So what I mean by that, sometimes you bring a federal grant and you plan to contract with this agency to conduct the service, but unfortunately this agency doesn't meet the federal requirements of what it takes for us to even be able to enter into a contract with them. So the challenge is now that we didn't have the resources. Now we have the resources, but we don't have the agencies that are structured in a way to be able to receive federal funds through the board. But we are working on that to change it. We'll have a proposal for you guys. Any questions? Well, Robin, go ahead with next item.
All right, COQ reporting data is the next item. It's probably the driest part of the meeting agenda. And Mircha gave me the challenge to try and make it interesting, but I don't know how you make data interesting. So
can you say what COQ stands for?
Culture of quality. And back in January of this year, the board approved a continuous quality improvement policy upon the recommendation from our culture of quality review that was done in June of 2019. Mircha, why are you laughing?
So many policies, sometimes it's hard to keep track of. But I do want to mention for Pali, this is a voluntarily processed by the boards in Ohio. And I believe out of 50 boards that are currently in Ohio, I would say that between 25 and 30 are COQ certified. And we are one of them. And we were probably in the top 10 across the state that received this certification. And I think we are going into our 10th year of being certified. But through this process, we are always looking at improvements, as Robbie mentioned. So one of the statement in our policy is to provide a report, I believe, twice a year to the program committee.
And in our policy, we have 5 different categories. And in those categories, we have a total of 8 goals. So I'll try to quickly go over what those 8 goals are and how I felt we did overall. So the first 2 goals just talk about making sure there's education and related trainings for the community, the providers, and the board members. And I can say we more than met that goal this past fiscal year of fiscal year 20. We probably would have even had more had COVID not hit, but we had the CIT training, we had QPR, mental health first aid, Narcan, trauma training, and then the board had their ethics and cultural and drug training. So we did well with that one. And I think that's one in fiscal year 21 we'll still be able to meet, even with the challenges of COVID, because now we're adapting to this virtual world that we live in now. The third goal is to collect, monitor, and report on suicide and overdose deaths. And this is one that Nicole leads us in, and we're to do this yearly. She works on this quarterly and has a fatality review meeting where we look at the data that we've received. And then once a year, we confirm the local data that we get from the health department with the state and review that information to compare it to what we have locally. And so she was able to do that in fiscal year 20. Again, COVID brought some challenges and we didn't get all the data by the end of the quarter, but we're picking that up in our first review for fiscal 21, which is at the end of this month. We'll be looking at some of the data that we didn't get at the end of the year because the health departments were just so challenged with priorities with COVID that they couldn't get us the numbers.
Hey, Robin, I want to mention here quickly 2 things. The fatality review our board implemented probably 3 years ago. Again, looking at all fatalities that are suicide related, overdose related, or car accident related. And then we're making recommendations. It was a closed group because of confidentiality and all that. So this wasn't really a mandate by the state of Ohio, but there were a few counties that have conducted this. What is mandated by the state of Ohio for us to do every year a child fatality review. So those are mandates where you have the health department, the coroner, and so on. But one interesting thing that I actually have a conference call on Tuesday is we have pushed the state. You know, the state has implemented where they let us know now of overdoses that are not deaths, but overdoses that are recorded in local ERs, through the ER system. So they're telling us every week, hey, this week in Wyandotte County had 1 overdose. Okay, this is all through the hospital system. Now we are working to implement with them the same thing when it comes to suicide attempts. And actually I schedule for us being one of the pilots to discuss about this. And we have a conference call on Tuesday. So we try to see if we can do, fatality review was looking after the fact. It was a fatality took place, here it is. Now we're trying to look at attempts of suicide and overdoses that don't result in death. Sorry, Robin, keep going.
That's okay. The next goal was that we would collect, monitor, and report on community psychiatric emergency services. And again, this is something that Nicole, as our prevention and education coordinator, oversees. But this we get quarterly, mostly from Firelands, and then we share that in our mid-year and end-of-the-year reports with the board members. And then as Mirch and I have been looking at the emergency services system, we've also been collecting different data to evaluate our system. So we feel we've been able to meet that goal. The next goal is to collect, monitor, and report data on our community health assessments every 3 years. and we're pretty active. Again, this is Nicole's section where she's involved in each county with their health assessments, with actually making the assessments occur, and then the strategic planning and monitoring pieces that come out. In every county, we have current assessments. We have in Seneca County, theirs was last done in 2019. Sandusky was 2020, and then Wyandotte is 2018. So next year they'll be working on their new assessment. Any questions with that? Next one is to provide program and fiscal audits, a minimum of 4 times each year. We select Firelands and Oriana House every year because they're our certified providers. And so we were able to get those completed. This past year, we were on target to have task added and reviewed this year, and our person who had evaluated Firelands and Oriana House felt she was going to be able to do it in May. And then because of COVID and her own personal struggles with it, she was not able to do that. So we were not able to get tasks completed. We did add prevention connections, which we had a little bit of delay getting that done, but we're able to get that done for the fiscal year of 20. So that's all in that section. The next goal is to review client family complaints and grievances, including client rights, civil rights, and client abuse and neglect, and review all reportable incidences. So when it comes to complaints, I mean, we hear a lot of things on the fly, but this is really the ones where people come forward and put something in writing. And so for fiscal year 20, we had 1 written complaint. And it was in regards to a person believing his rights were violated because of a respect issue with an agency staff person. And we worked with that individual and the management team for that agency, and the client felt that that got resolved. As far as grievances, we did not have any reported grievances. Reportable incidences, now this is defined by OMAS. There are certain categories that are considered reportable by our certified agencies. And so when there's a reportable incident, they are required to go into what's called the WEIR system. And again, that's provided through OMAS, and they generate the report, and then we receive a copy of that. There's not a whole lot of information on that report, but we try to follow up and make sure that the issue's been addressed and resolved. And so for fiscal year 20, we had 9 reportable incidences. Now, 7 of those involved residential treatment facilities for our youth. And so these are not homes or facilities in our board district, and they may not even have any current involvement with our treatment agencies. This is youth who have gone maybe to the Dayton area. And so we may not know of these youth, but they're originally residing in our youth or in our county and are at these facilities. And the 2 issues and trends that we saw was inappropriate use of seclusion or restraints, and then physical assault injury by non-staff persons or individuals. So a lot of times what I see is 2 youth got into a fight with each other and they had to report it. There was 1 incident where it was a staff person who was inappropriately aggressive with an individual. And by the time I received the report, they had already addressed it, and that person was no longer employed with that facility. And then the other 2 incidences were deaths of clients. Both of those were suicides. And for individuals. Now that might seem kind of low, but what you have to think about is, we know our suicide rates are higher, but this comes down to, were the individuals at the time of their suicides, were they receiving services with an agency? So not all our suicides are going to be reported in the WEIR system because they have to be actively receiving services with the agency. And then our final goal is just that we'll report on this on an annual basis. And so that's what we're doing tonight. Any questions?
Well, sometimes I think it's common, and we have seen this 2020 is sometimes individuals in group homes, they maybe are out of county to have incidents with other clients, whatever is violent or sexual assaults. That's appears to be common, I guess, compared to the rest when it comes to adults. If we don't have questions, we'll move on. You guys can ask questions anytime. The board's records retention schedule that we submitted, I believe in June, through a motion has been approved by the Ohio Auditor of State and by the Ohio History Connections. Just an update, it's approved, it's in place. As you probably already know, that has to do with all the documents we have in our possession and what can be destroyed and when, and how we should file them, electronic versus paper, and for how many years and so on, really what that does. So that is in place. Just a reminder, for example, board meeting minutes are permanent. We keep them forever. Most of the fiscal and grants, they are 7 years past a completed audit before we can destroy them. So just two examples. Lotus certification, Robin?
All right, so this is a three-part certification, and the first part is the policy review, the second part is the phone interview, and then the third part is the site visit, which would have all happened by probably June, but again, COVID delayed our site visit, which occurred this, I believe it was September 2nd. They came to our home. They were not there very long because really all they were looking at was the physical structure and making sure that we met the standards with that. And then when they left, they felt pretty confident that we were going to be certified. They gave a lot of compliments, said they wouldn't mind living there themselves. And then I received confirmation today that the board met yesterday and awarded us our certification. So we're expecting to receive that anytime in the mail in the next week or so. So glad to be done with that portion of Lotus.
Hey, congratulations to Robin
That's awesome.
and
Thank
Stephanie
you.
and Tanya.
Congratulations,
and everybody
Robin.
involved.
Thank you.
I do want to remind again, I like to go back a little bit. I believe was December of 2018 or January of 2019 when we took on this project for the first time, really in our history of 52 years. We wanted to invest into a different capital project that is specific to services, and we to own it and operate it at least until it gets certification. So July 1 of 19 is when the first client moved in. The goal was again in 18 months to have it, I believe, certified. Now with COVID, we were delayed quite a bit, as Robin mentioned. Really that no changes they really needed to our policies, procedures, or operations. As a director, I'm very proud of the project. I do think that probably in upcoming years we might pass this on to our organization to run it, but we'll probably always gonna own it, the building. So we'll see in a few years how things go and if an expansion of recovery supports is needed. But this is a really neat project that I think many recovery houses across the state will use it as a pilot, especially when it comes to the policies and procedures. And I won't be surprised if Robin gonna be part of the Ohio Recovery Housing Board to see in the future how recovery houses get certified in the state. So this is great. Two more items. One is stepping up. Robin?
Sure. This Friday, September 18th, from 11 a.m. to 2 p.m., we're scheduled to be the local host with the Ohio Stepping Up team and the PEGS Foundation to have a local discussion on how we can look at our successes and challenges of meeting the mental health needs of persons in our local jails and criminal justice system, particularly Seneca County. We have retired Ohio Supreme Court Justice Evelyn Stratton and Tom Craig hosting along with Mircha. The agenda items include looking at our services at the jail, the state resources that are available that could enhance our service delivery, our veterans and how they're served, along with our local assisted outpatient treatment program. It's scheduled to be a virtual meeting hosted by our guest presenters, and we've received RSVPs from some of our local judges or their representatives. We have law enforcement, NAMI, firelands, housing providers, county commissioners, and representatives from the local hospitals. Mircha, myself, and Celinda will represent the board. If anybody else from the board is interested in participating, just let me know and I can send you the link information. We had a planning meeting last week and we believe we're all set for that local discussion to occur.
Give a little history here too. That a few years ago, probably around 5 years ago, there was a initiative across the country that was called Stepping Up, and was really focusing on assisting individuals with mental illness who are incarcerated in local jails. Ohio took also a lead into this project, and at that time, around 5 years ago, with assistance from county commissioners, all 3 sets of county commissioners committed at that time to be considered a stepping up county, to look as best practices for individuals with mental illness in the county jails, to implement behavioral health programs in the county jails. We had a follow-up around 2 years ago, in-person meeting here in Seneca County with retired Supreme Court Judge Stratton. She came over. I will say that probably Seneca County maybe took a lead, more of a lead than the other 2 counties. Therefore, they want to have a second follow-up meeting. But we have a lot of services that we implemented over the last 5 years in all 3 county jails. This project, again, it's focused on individuals with mental illness who are incarcerated. What do we do with them after incarceration? What kind of services and supports we have for them to stop the revolving door of people in and out of the judicial system. So there are a lot of new initiatives. Many we implemented. There are a few that we didn't, and that I think will change in some of the counties. But yes, so when there's a program that is not implemented, it can be that we don't have the capacity, or it can be that maybe whoever is leading an organization is not there yet with the rest of the group, and something that interferes. I think a project like this can really work if you have the sheriff's office and the jail on the same page with the treatment agencies, on the same page with the judges, as these individuals usually circle among all 3. So again, if you want to participate, it's a 3-hour meeting. I don't know why they want to have it so long. My speech will be 5 minutes or less. But if you want to join, again, it's Friday. Let Robin know. Last item is...
So the next item is the QRT in Wyandotte County, and I'll give you an update on that. Last week, we received an email from the Wyandotte County Prosecutor's Office requesting our input on a door hanger that they were developing for their QRT team. If you remember, QRT means Quick Response Team, and we've been working with law enforcement and firelands to implement this program in Seneca County. We were not aware that Wyandotte County was ready to move forward with having a team. So we were excited when they outreached to us, and we were able to talk to them about their program. I ended up talking to Jenna Hamilton from their prosecutor's office, and she shared with me the status and the minimal requirements to do a QRT team is really to track your overdose data and then hang a door hanger with resource information on the door where overdoses have happened, hoping that you get resource information to the person or the person's family that overdosed. And so right now, Wyandotte County really is focused on making sure that they meet that minimal standard, but ideally they want to be able to expand and add that clinical portion that Seneca County has to the program. And so she was very interested in learning about Seneca County, even though even Seneca is still rather new. We're further ahead in the process here than where they're at. Their desire is to partner with us as a board and to design their program when they're ready to look much like Seneca County and even share the same resources. So she had already had some conversation with Firelands about potentially partnering with them down the road. And we too have talked to Firelands, and they're excited to add Wyandotte County when they're ready. The challenges that they feel they face is when they look at their data, they don't see where they have a huge need to warrant obviously a full-time staff person. But even on a part-time basis, they think they have 1 to 2 overdoses a month. And so how do you plan and expect for a clinical person to respond when it's only needed once or twice a month? Where Firelands in Seneca County, they have enough volume that right now they carve out Monday mornings and Thursday mornings to respond to any overdoses that have occurred. So again, they want to add that clinical piece. They want to look to the board and Firelands for partnership. They're just again trying to meet that minimal standard and decide where and how to proceed afterwards.
All right, I do have here some additional comments, and I did have a discussion with Polly about this earlier, I believe in a week. So Polly, if you want to time in as well. But again, I'm going back to give some history for the newer board members. I think initially, out of all 3 counties, we wanted to implement something similar to this in Sandusky County. And we had various discussions there with law enforcement prosecutor and some other county leaders around 3-4 years ago. And at that time, Sandusky County prosecutor wanted to take the lead, or was chosen to take the lead. Was a newer law that passed then that was called the Good Samaritan Law. And really what the law said in a nutshell is the reason the law was introduced and signed was because individuals were overdosing, sometimes together, and they were cleaning up the drugs around them and oftentimes just running out of the house and never calling 911 because they were concerned about getting arrested. So Good Samaritan Law, really what it says is saying, hey, if you are a user, if you're using with somebody and one of you guys overdose and a few people overdose or whatever, if you call 911, we are not going to prosecute you. You have immunity. And we wanted to do this so we save life, because we realize that you guys are trying to clean the drugs, flush them down the toilet, and maybe then call 911 when you're out the door, and by the time we arrive, this person is dead. Okay, so again, this gives them immunity. However, there are some ifs. If you're already on probation, forget about immunity. So there are a few stipulations there. So it's not like a black and white, but in general, it gives the person immunity. However, the immunity is good only 3 times, like a baseball. Okay. Now, when the law was introduced, law enforcement and prosecutor were saying, well, how good is 3 strikes you are out? Because none of us can keep track of the strikes. We don't have a system that can keep track of how many times Johnny overdoses. So if I overdose tonight in Tiffin and then tomorrow night I go and overdose in Upper Sandusky. Tiffin system and Upper Sandusky system don't talk, so they don't have me like, hey, this guy overdosed twice in 2 days, and the system is not even working today like that. However, Sandusky County said, we can do it countywide. We can't do it in our server, but we can do it countywide. And at that time, the prosecutor's plan was, I'm going to look at all 911 calls. I'm going to see every time you guys responded, every time law enforcement responded, you guys going to give them this piece of paper to the individuals who overdose. And by the way, according to the law, you had immunity if in the first 30 days of the incident, you received an assessment, an AOD assessment. So the paper that the prosecutor's office approved to all law enforcement organizations in Sandusky County is somebody overdoses, EMS is there and you are there. If you make contact with them, you give them this paper. This is their rights. This is their strike. They have to seek an assessment from one of the providers in a county. And if they don't seek an assessment and show us that they seeked an assessment, we're going to go ahead and file charges on them. And their goal was, they thought that, hey, if I put the hammer down on these individuals who are addicts, they're going to go to treatment, correct? Well, I'll be honest, this meeting is recorded, so what happened is they were just swamped with drug trafficking cases. They didn't even ever have a chance to really follow up on these people who are just users. So the system really was swamped. They were so backlogged on trying to figure out how many people overdose when they had to follow up the drug traffickers that it didn't really happen much. We had a few people who went for an assessment that we know. Oriana House was the main provider used. But also, fast forward a little bit more, as you guys know, county prosecutor had his own legal issues and is no longer the county prosecutor. And it's something similar, to be honest, happened with the Sandusky County Jail when we implemented some programs, and then the Sandusky County Sheriff had his own legal issues and he was no longer the sheriff. So when you have a change in leadership, sometimes the programs might be faded away. So I am planning to approach Sandusky County and reintroduce them to the QRT model. Maybe not yet. I want to see where Seneca County goes and Wyandotte County goes. It's nice to have a successful program that you can present, but that is where we started. And the reason Seneca and Wyandotte is back now on a map to implement this, again, just so you guys know, they are part of the Metrich Drug Task Force, which Sandusky County is not. And if you are part of this drug task force, state of Ohio is awarding you money that Sandusky County doesn't get. So here in this case, Seneca and Wyandotte, they get some additional funds through their drug task force that they can use for this project. And I know Seneca County used the money to purchase a vehicle with these funds to be able to do these twice a week runs. So again, it's just a little more information and education for you if you wonder why Seneca and not Sandusky. Questions?
America, I've been here. America? I don't know if you can hear me.
Yes, I can hear you.
Okay. I just want to comment on Wyandotte County, 1 or 2 overdoses a month.
Yes.
I would say I've probably been hearing this for the last 6 years.
About 1 or 2 a month?
Yeah, so I see that, and I find that very interesting. So I'm not sure how they how they have in the past collected the data, but it seems like they're willing now to get much more involved.
I would say yes, we see a progress there in them wanting to get involved. I will tell you that there are 3 things that we looked at in the past. One, we were always looking at the actual deaths, overdose deaths, so we know, hey, how many deaths we had a year in Wyandotte County, okay? But with those deaths, there were 2 challenges. One, they had to be reported by the county coroner as overdose deaths. And then 2, there was a question about Wyandotte County individuals who maybe overdosed in a different county and passed in a different county versus so on. So some people say, well, these numbers are not right. But I will tell you that the 2017 numbers that this big federal grant took into account, they mark Wyandotte County as 2 overdoses per year. 2 overdose deaths per year, okay? So again, people will tell you, well, these numbers are not right because so-and-so didn't record them right, okay? Or on a death certificate, they put something else, or they put accidental, or whatever, okay?
Right.
That's one. The second thing is usually what numbers we get from the prosecutor's office based on their, again, 911 calls or investigation and stuff like that. We rely on law enforcement or prosecutor. But the last number that I'm getting now weekly that actually matches what the prosecutor's office is saying, I get the numbers from the local ER, which is only one hospital in Wyandotte County, the Memorial in Upper Sandusky. And again, I get the weekly email from the state that records everything that's happening in Wyandotte County. And based on the ER overdoses, they do average approximately 1 every 7 to 10 days. That's what they
Did you say 1 every 7 to 10 days?
Correct. This is not a fatality. This is just an overdose, and this is
Right.
through the hospital system. Because again, as you know, Polly, you can have overdoses that never end up into the hospital.
Of course. Okay. Okay. So there are some checks and balances to take a look at this and collect the data and follow it.
Yeah, another thing that, again, we just know from the drug task force units in the 3 counties is that this is kind of a funny joke, but according to our history working with the drug task force unit, it appears that Sandusky County, it's where most of the trafficking is taking place or sell, but a lot of the users, even in Sandusky County, are actually Seneca and Wyandotte County residents. So oftentimes they drive there, they buy it, and many times they use it before they even get back home.
Right.
Sometimes they use it right where they buy it. And we have no cases where Seneca and Wyandotte County individuals overdosed in Sandusky County.
Yeah.
Very rare we have Sandusky County residents coming to Seneca or Wyandotte to purchase the drugs and overdose here. Which I just never heard that. But I hear about Seneca and Wyandotte going to Fremont all the time.
Uh-huh.
Marcus, you got to keep your people in place there in Fremont.
I'm only one person.
Marcus, I know your feeling.
I've got about as many from Fremont as I do over there in Seneca.
Hey, Marcus, was that statement actually true, or was that a joke?
Which statement?
You said that you have as many from Seneca as you have from Fremont. You mean on probation?
Yeah, we have a large population of people from out of kind of like what you stated, where people come to Fremont to get those. So hence, I guess, ergo, they come to Fremont, overdose, or don't get back, or get pulled over for an OVI, and then they find certain substances. They're placed on probation here. So we do have a high amount of people from outside of Sandusky County on probation here.
Okay. So it kind of matches. You're right. And again, I don't really have data to back it up other than just the communication we have with law enforcement and the drug task force unit. With some of them,
That's correct.
With Seneca County, we work very closely. I mean, with the drug task force unit here, I mean, they call us all the time when they think somebody needs treatment and not, they don't need them.
Yeah, and in the same breath, it's you get a lot of mutual clients or people. They're in both counties. Both have pending charges in both counties, or on probations in both counties, either misdemeanor, or common police courts at the same time.
Yeah, and as you know, Marcus, if some of them are users, they don't have a permanent residence. They kind of keep moving around.
I do agree, or that, and or what our counties being so close, they go back and forth quite often, quite frequently. They hop back and forth of, like, no permanent residency. So they'll stay with people in Tiffin. They'll stay with people here. They go back and forth.
Marcus, I had the same thing when I worked probation.
Yeah, I'm sure. I agree. I'm sure you did.
I did.
Well, we are at the end of our agenda. If you guys have,
Mircha, can I talk about the admin committee's discussion about your annual evaluation?
sure.
Okay. So the admin committee met on Monday and discussed options on how to proceed with Mircha's annual evaluation. Under normal years, that evaluation would have been completed and discussed by the board by the end of the June meeting. And because of COVID and not being able to meet face to face, we talked about pushing that off until the next face to face meeting. And at that time, I think we all really believed that our next face to face board meeting would happen in August, maybe as late as September. But as we sit here now and realize that it could be several more months and halfway through his performance year before we have that face-to-face meeting, we decided to talk about it as an admin committee, and it was probably the longest discussion agenda item. We talked about the need to get in writing from the Ohio Attorney General's office that we could enter into an executive session during a virtual meeting. We talked about allowing Dean to take his goals and review them himself and make a recommendation on which goals to give to Mircha. And then there was also discussion about the importance of the board members all being involved with that decision and discussion. And so where we landed was that Mircha's evaluation, including all his goals, will be emailed to all board members and Mircha. I hope to do that sometime tomorrow. And then Dean will make a motion at the September meeting to accept all of the recommended goals at that time. I believe there's I think there's 7 or 8 goals, none of which are any that Mircha's not already working on and going to accomplish. So instead of trying to select some and just pick 4 or 5 like we usually do, the decision was that we'll just give all of them to him because we know that he's going to be able to achieve those without any concern. And so there would be no need to enter into executive session as there's no salary adjustment at this time due to the resolution passed in the spring. Mircha's still going to try and get it in writing from the Attorney General's office on what we can do as far as entering into executive session during a virtual meeting, because we may not need it now for this issue, but in the coming months, something could come up and we just want to make sure we have it in writing from them on how we're able to handle that. And so all of you should receive an email from me with his evaluation, and the evaluation is going to include the compiled scores that I got from everybody, all the comments that were written, as well as all the goals that were recommended. Any questions, any comments?
No, Mircha, I think you're doing a wonderful job, and I thank you, and you too, Robin. You guys work so hard, and I appreciate what you guys do. So thank you.
Thank you.
Any other comments or discussions prior to us adjourning? If not, I will stop the recording at 5:58.